It's normal to feel anxious about screening appointments, and as a trans, non-binary or gender diverse person, you might find even contemplating the process dysphoria-inducing or overwhelming. This information is here to help you know what the process looks like, who it's for, and why it's important. As a community, we may feel our health decisions often get made for us, not with us, but screening is an opportunity everyone who is eligible can benefit from, and there are lots of things you can do to help make it more comfortable for you. Attending breast screening and self-checking are the best ways to ensure breast cancer is detected early. Being diagnosed and treated at an early stage may mean that you're more likely to survive cancer. Breast screening does not prevent breast cancer. It helps detect breast cancer at an early stage when treatment can be more successful. By attending breast and chest screening and learning how to self-check your breast and chests in the comfort of our own homes, we can all better look after our health in the long term. Taking part in breast screening is your choice. Cisgender women, transgender men who have not had a bilateral mastectomy or top surgery. If you have had top surgery, we recommend you talk to the consultant who carried out your surgery about the amount of breast tissue you have remaining. If they can confirm you still have breast tissue, we recommend you consider having breast screening. Non-binary people assigned female at birth who have not had a bilateral mastectomy or top surgery. Transgender women and non-binary people assigned male at birth and who have been taking long-term hormone therapy. The Northern Ireland Breast Screening Programme invites people who are eligible for routine breast screening. When you're due for breast screening, you will receive an invitation letter. You should receive your first invitation before your 53rd birthday. Individuals aged 50 to 70 who are registered with a GP as female and live in Northern Ireland are invited to attend breast screening every 3 years. If you're over 70, you're still at risk of breast cancer. Although you will no longer automatically get screening invitations after you're 70, you can still have breast screening every 3 years. You'll need to ask your local breast screening unit for an appointment. If your gender marker on your GP records is male, at present you will not be automatically invited. If you feel you need screening and are not automatically invited, contact your GP to talk about how to arrange a mammogram. Your invitation will consist of a letter with details for your mammogram appointment, date and time, and an information booklet explaining what the breast cancer screening programme is all about and the benefits associated with breast screening. You can call ahead and ask for reasonable adjustments such as bringing a friend along to the appointment to support you or asking to talk through any anxieties you might have. For additional accessibility, all mobile units are fitted with lifts. Your visit to the screening unit will take around a half an hour. A receptionist or a female radiographer will welcome you and check your details. The radiographer will then ask about your current breast or chest health and any previous breast or chest problems. They will explain how the mammogram is taken and answer any questions you have. Breast cancer and breast tissue are clinical terms and are commonly used throughout the screening process. If you prefer to refer to this area as your chest, inform the radiographer at the beginning of the appointment. There may be times when staff need to speak clinically and times when they can speak personally. They should be able to explain the difference between these. Breast screening involves a mammogram which can detect cancers that are too small to be found by physical examination. This allows earlier treatment with a better chance of a successful outcome. A mammogram is a low-dose X-ray of the breast that shows the internal structure of the breast, just like a chest X-ray shows the inside of the lungs. Before it is carried out, you will be asked to undress to the waist and to remove body coverings such as a bra, binder, and clothing. Your chest will be placed on the mammography unit. The breast tissue is compressed between two clear plastic plates and then X-ray images taken. Compression of the tissue is needed to get the clearest image using the lowest amount of radiation possible. Some patients may find this uncomfortable for a short time while the breast is being compressed. You'll need to stay still for a few seconds while the X-ray is taken. Images of the breast will be taken at two different angles, a view to include the armpit and a view taken from above. This is so that all of the inside of each breast can be seen. After the X-rays are finished, you'll be able to get dressed and are free to go. You and your GP will receive the results in writing in 2 to 3 weeks. After a normal result, you'll be invited back for a routine mammogram every 3 years. However, 4 in every 100 people will be asked to go to an assessment clinic for further tests. This happens when the health professional reading the mammogram detects a difference in breast tissue in one breast compared to the other, or a difference from a previous mammogram if the patient has been screened before. At the assessment clinic, when further tests are completed, 3 out of 4 people will not have cancer and will continue to be invited for screening every 3 years.
Very good. I was a bit anxious, but I'm glad that it's over and I've gone for it. Yes. Very helpful and very cooperative.
Call the clinic ahead of your appointment to ask questions or discuss any concerns. Tell the mammographer the language you'd like them to use when referring to your body. Ask staff not to use any phrases or words that make you uncomfortable or nervous. Let the staff know which name and pronouns you'd like them to use. Ask to bring a friend or trusted family member with you to your appointment. Using a spray or talcum powder can affect the image. It can show as residue. It may be better to not use these products on the day of the appointment. Tell them if you've found screening uncomfortable or painful in the past. Request an appointment at the beginning or end of a clinic to avoid long stays in the clinic or waiting room. The radiographer will need to touch your chest in order to position your breast for the mammogram. Let the staff know if people touching your breasts or chest is a dysphoria trigger for you so they can work with you to get the clearest images possible. Wear something comfortable that you can easily undress to the waist. Breast screening can be uncomfortable, and in a few cases some people can find the procedure painful. Talk to the mammographer if you're concerned about pain or are in pain during the procedure. They're trained to help you feel more comfortable and give you support. You can also ask to stop at any time. Mammograms are safe for people with breast implants. Just make sure you tell the person conducting the screening before your appointment. If you have implants, the mammographer may take more x-rays. This is so they can see as much breast tissue as possible. A mammogram examination on breast tissue with implants requires 6 images as opposed to 4. Not all of the breast tissue will be visible on a mammogram with implants. The report is only based on what the reporting radiologist can see.